Did the CEL work change your community social outlook in any way?
Yeah, so I volunteered with the Hay Free Clinic for community engaged learning, and it really did kind of change my outlook on my community around me. So the Hay Free Clinic is down the street from where I live, and so I actually got to see and care for a lot of people in my direct community here in Sugar House. And I didn't realize that how many people in my community alone didn't have access to healthcare, health insurance, and just how much people were struggling here just around me. And I thought that was pretty eye-opening. And so over my time at the clinic, I felt like I gained a deeper insight on that.
Are there any assumptions about the people that you were serving that you have reconceptualized?
Yeah, so there were two assumptions that I've kind of had prior to volunteering at the clinic and even kind of early on. One, I had heard a lot about how when you give free things to people, for example, free healthcare, that some people may take advantage of that by maybe not going and seeking out a job to be able to have their own health insurance, pay for their own healthcare needs. And although I didn't think that was going to be very common, I thought that I would see a little bit of that over at the free clinic. Maybe some people that weren't very motivated to kind of be able to meet their own healthcare needs, and so they were taking advantage of existing systems that were there. But at the free clinic, I didn't really see any of that. More of what I saw was people in the community that were really trying hard to do their best to survive in this community here, and that them coming to the free clinic was the extra boost that they needed to kind of continue to kind of survive in more of a struggling situation. So people that were working, didn't make enough to really be able to pay for their own healthcare, can now go and get healthcare, whereas otherwise they would just not go and see doctors and providers. And also the second assumption that I had at times was I would constantly see no-shows show up on the schedule, and early when I was volunteering at the free clinic, I assumed that people who weren't showing up to their appointments were being lazy, and I was like, wow, I can't believe people can't even show up to their own free appointment. But I didn't realize that some of the barriers that these people face to get health insurance or healthcare go beyond money to pay for their care and insurance, and it stems to not being able to get a ride to the free clinic. I think that was super common. I actually spoke to a patient once where they're like, oh, I'm so sorry, I missed the last 2 appointments, I can't miss any more appointments. I had my car break down, I didn't have another car, and they just weren't able to make it to our actual clinic. And a lot of these people travel from really far away, so I started to realize that a lot of the no-shows were not people that were too lazy to make their appointment. They were just people that physically could not make it to the clinic at that time, and those people that we're serving struggle more to be able to make it to their appointments than we would.
What are the strengths and skills that help you the most through your community engaged learning work?
Yeah, so I think first, my background helps me a lot. I feel like I identify a lot with the patients that we see. A lot of the patients that we see are minorities, most of them Spanish speaking. We do see a lot of Middle Eastern patients there, kind of from that community in Sugar House. And so I think I have a good ability to be able to connect with them. For example, a lot of the Middle Eastern patients that we see, they come in and they do speak English most of the time, but I know that they really appreciate it when I'm able to speak to them in Arabic and really identify with them and their culture by speaking to them in Arabic. A lot of times I make jokes in Arabic, make them feel more comfortable, and I know that those patients really do enjoy when I am kind of able to appeal to their culture while we're at the clinic. And then also I think another useful skill that I have is that I work in healthcare outside of volunteering. I work as a cardiology technician at the U, and so I have experience working with patients, taking vitals, taking blood pressures, and then also I have experience doing a lot of the miscellaneous tasks that a lot of people at the clinic don't do. For example, as a cardiology tech, I take EKGs, and so that is something that we do need every so often, is that we take EKGs for patients at the free clinic, and so I am able to do that, and I have a fun time doing some of those specialized tasks that some other people might not be able to do.
Do you plan on volunteering with an organization beyond this class? If so, in what capacity?
Yeah, so I plan on staying at the Lehigh Free Clinic. I was with the Free Clinic before the CEL program and kind of just continued to work and volunteer there during the CEL program. I love it there. I enjoy the people that volunteer there with me, and I enjoy interacting with the patients. And then along with that, I also have been exposed to the Utah AIDS Foundation through this program. I volunteered there a little bit a couple of years ago, and I would like to rejoin. I've since gotten a little more excited about it since we've done the HIV and AIDS modules for microbiology, and so I think I'd be able to contribute a lot more to the AIDS Foundation than I did 2 years ago, where I didn't know what was going on. And so I'm actually excited to volunteer at the Free Clinic after this, and then continue to actually move over to the Utah AIDS Foundation and hopefully start volunteering there in the near future.